Good morning, or I guess good afternoon, everyone. My name is Alberta Noonan, and I'm from the New England QIN-QIO, and I will be your moderator for today's webinar, Check, Change, Control Cholesterol. Before we get started, I want to review a few housekeeping items. This call will be recorded for training purposes. I'll provide you with details on accessing the recording at the end of the webinar. The phone lines will be on mute for the duration of the presentation. We will take questions at the end of the presentation. At this time, I will provide you with instructions on how you can ask a question over the phone. You can also pose a question in the chat box throughout the presentation. Please make sure to send your question to all participants. So at this time, I'm going to pass this over to Karen Evans, who is from...
Thanks.
Go ahead, Karen.
Thank you. Good afternoon. This is Karen Evans with the New England QIN-QIO, which is administered by Health-Centric Advisors in partnership with Qualidigm. Welcome again to the Check, Change, Control Cholesterol webcast, highlighting a brand new program from the American Heart Association. Improving cholesterol levels decreases the risk for heart disease, which can reduce unplanned hospital admissions, readmissions, and emergency department visits. In addition to negatively impacting the quality of life for people, avoidable hospitalizations contribute to escalating healthcare costs. The Centers for Medicare and Medicaid, or CMS, continues to create value-based payment systems that enable them to pay more for care given by providers who can demonstrate higher quality and lower costs by improving rates for specific measures. We're grateful to Stephanie Barba and Sherelle Rozzi with the American Heart Association here with you today to share some practical, evidence-based resources that can be used to improve cholesterol outcomes, which can help you target related MIPS, ACO, and even the C in the Million Hearts measures. You will find Stephanie and Sherelle's contact information just before the questions slide toward the end of the presentation. The New England QIN-QIO, along with QIOs across the country, provide no-cost support to providers to help them with their quality reporting in general and to improve specific measures that make sense for each organization. We offer focused interventions for several areas, including diabetes and cardiac-related outcomes, as these are two of the top drivers of avoidable hospitalizations. At the end of today's presentation, we've given you links to some helpful resources and contacts in each of the New England states who are here for you. Stephanie Barba is the Community Health Director for the Greater Boston region of the American Heart and Stroke Association and works to bring wellness and quality improvement programs to corporate work sites, the community, and healthcare practices. She is the lead for the Board of Directors' Community Health Priorities with a focus on food access, blood pressure, and cholesterol control. Stephanie received her Bachelor of Science in Business Administration and Marketing from the College of Charleston. She strongly believes in educating and working with groups and building networks of volunteers and community partners to increase awareness of the impact that access to healthy food and nutrition has on overall health. Sherelle Rozzi is the Director of Multicultural Initiatives and Health Equity for the American Heart and Stroke Association in Greater Boston. Sherelle received her Master of Public Health degree with a concentration in Community and International Health from New York University. She is passionate about public health and disease prevention and specifically social determinants, health disparities, and inequities in communities of color and other underserved populations. Her personal interests include youth development and health equity, civil rights, community work. Welcome to you both. Stephanie, I'll turn it over to you.
All right. Thank you, Karen, for that introduction. So, good afternoon, everyone. Again, this is Stephanie. I will be starting us today, and Cheryl and I will be alternating throughout this presentation. So to start, a little bit about the Check, Change, Control Cholesterol Initiative. This is a national initiative of the American Heart Association to reduce the number of Americans who have heart attacks and strokes by urging medical practices, health service organizations, and patients to prioritize high cholesterol recognition and treatment. CCC Cholesterol seeks to support healthcare providers across the country to screen and treat at-risk patients at a rate of 70% or greater among the patients they serve. To help achieve this goal, CCC Cholesterol empowers registrants with a dedicated website featuring a free, evidence-based improvement program that includes tools and resources to help them track and benchmark cholesterol diagnosis and management in practice. So a little bit about the Heart Association and really why the focus on cholesterol. The mission of the American Heart Association is to build healthier lives free of cardiovascular diseases and stroke. AHA has set a goal of improving the cardiovascular health of all Americans by 20% by 2020 and decreasing the mortality from cardiovascular disease and stroke by 20% by 2020. We know high cholesterol is one of the major controllable risk factors for heart attack and stroke. When combined with other risk factors such as smoking, high blood pressure, or diabetes, the risk increases even more. We recognize that if we are going to reach our 2020 goal, we have to look at high cholesterol. And a part of that 2020 goal, the AHA aims to move 9.3 million U.S. adults to cholesterol control. Currently, in adults, total cholesterol levels should be at or below 200 milligrams per deciliter. Data indicates that 40% of U.S. adults have total cholesterol levels at or higher than that. LDL cholesterol levels above 130 milligrams per deciliter are considered to be linked to increased health risks. Nearly 1 in 3 adults in the United States have high levels of LDL. And so overall, it's predicted that about 12% of Americans have total cholesterol levels over 240 milligrams per deciliter. So a little bit more about the link between cholesterol and cardiovascular disease. In 2013, the American Heart Association's clinical practice guidelines moved away from treatment of a specific cholesterol level to treatment based on a 10-year risk of having ASCVD or stroke event. This risk is calculated using the evidence-based ASCVD risk estimator, the provider tool, or the check change control calculator, the patient tool. We'll discuss both of these a little bit more in depth. So the ASCVD risk calculator is a peer-reviewed online calculator that estimates the 10-year primary risk of ASCVD among patients without pre-existing cardiovascular disease who are between 40 and 79 years of age. Patients are considered to be at elevated risk if predicted risk is greater than or equal to 7.5%. The estimator takes things like age, gender, smoking status, history of diabetes, cholesterol, blood pressure, current treatment for hypertension, and aspirin into consideration.
And so, hi everyone, this is Sherelle, and so I'm going to go into why using the ASCVD risk calculator is beneficial. And so, this calculator is really a starting point for assessing ASCVD risk by identifying patients in at-risk populations who might benefit from preventative treatment. And so the resulting risk scores provide a baseline, really, to initiate an open discussion with patients as well as guiding decision-making regarding treatment options to prevent ASCVD. And that includes lifestyle changes, risk factor management, and pharmacologic treatment. And so really at the AHA, when developing programs, we want to focus most on, in the beginning, on educating as well as working with individuals to make lifestyle changes, and then focusing more on risk factor management, and then ultimately focusing on the pharmacologic treatment. But we want to make sure that we're doing more in terms of the education piece, lifestyle changes piece, and risk factor management first. On to the next slide. So when to use the calculator, we want it to be patients that are 40 to 79 years of age, who do not have ASCVD already, as well as patients with LDL levels between 70 to 189 milligrams per deciliter without ASCVD and not already on statin therapy. So when not to use this calculator is when you're working with patients below 40 years of age or above 79 years of age, as well as not for patients who have already had established ASCVD or with symptoms suggestive of cardiovascular disease. And so on this next slide here, you'll see the patient calculator as well as the provider calculator. And so another thing that AHA programs usually, when we're usually developing programs, they usually allow patients to be proactive on their own health. And so we want patients to be empowered to really take care of their selves before relying on a doctor or physician and care team. And so with the patient calculator, it allows patients to estimate their risk for a heart or stroke event using that link below where it says www.heart.org/CCC calculator. And then you have your provider calculator, which is the ASCVD risk calculator. And so with this particular calculator, some practices already use the calculator through their own electronic health records, and sometimes if they're not already using it, this feature is available through their electronic health records. But then you also have some practices that might not have this feature just yet, but they might be able to apply it through the EHR vendor over time. And so because we're only in the beginning stages when it comes to really prioritizing on controlling cholesterol, you're not required to utilize the calculator feature just yet. We're mainly just asking practices to begin prioritizing cholesterol, control programming with the intentions of utilizing this calculator in the future. And so if you don't have access to an ASCVD risk calculator through your own EHR, you're more than welcome to use the one here provided by the AHA at no cost to you or your practice. And you would find it at www.professional.heart.org/ASCVD. And also, you'll receive the link later on to check, change, control cholesterol, but the calculator will also be available on that site as well. All right. And so here you have check, change, control cholesterol, which I just mentioned. But the goal of this program is aligned with all of our recognition programs, and that is really to improve the health of the nation. Check, change, control cholesterol does seek to reduce the number of Americans who have heart attacks and strokes by urging medical practices, health service organizations, and patients to prioritize high cholesterol recognition and treatment.
So the Check, Change, Control cholesterol program has two levels of recognition. Again, really to get started, you can go to our website, heart.org/cholesterol, and again, navigate to the registration recognition to get started. So the first level of recognition is the Participant Award, and this recognizes organizations simply for registering with CCC cholesterol and confirming that their practice will incorporate the ASCVD risk calculator into their EHR. The goal of the Participant Award is to advocate for ASCVD risk calculation and identification of high-risk patients. In order for providers to start tracking high-risk patients in their EHR's patient population, the EHR must be able to document and track the results of ASCVD calculations. Therefore, we are asking participants to commit to incorporating ASCVD risk calculations into their practice, however possible in the beginning. The Gold Award is reserved for organizations that submit numerator and denominator information for MIPS measure number 438 and achieve control rates of 70% or greater within the adult patient populations they serve. MIPS was chosen over other quality metrics because it most closely aligns with AHA guidelines. Other quality measures only address small portions of the guidelines and would require sites to collect multiple measures to get close to what MIPS collects. Sites do not need to submit MIPS data to CMS to submit numerator and denominator numbers for CCC cholesterol. And so how much data is required to participate? So this maps out, some of what you'll see when you go into register and then for recognition. So for registration, you'll need to know your organization's total adult population greater than or equal to 21 years, the total number of clinical providers in your organization, the total number of clinical locations in your health system, and what electronic health record you're using. And for recognition, again, at those two levels, Participation simply is available once you actually go through registration and just that commitment to continuously improving and using data to capture ASCVD risk estimations. And then for gold, again, it's submitting that numerator and denominator data for MIPS measure number 438. And so here on this slide, we'll go into the criteria for MIPS a little bit. There are 3 submission criteria for this measure. The denominator is everyone during the measurement period. So that would be the previous calendar year, looking at 2017 data, who fall into these 3 risk groups. Adults older than 21 years who have previously been diagnosed with or currently have an active diagnosis of clinical ASCVD, or adults aged 21 years and older who have had a fasting or direct LDL-C level greater than or equal to 190 milligrams per deciliter, or previously diagnosed with or currently have an active diagnosis of familial or pure hypercholesterolemia. Adults aged 40 to 75 years with a diagnosis of diabetes with a fasting or direct LDL-C level of 70 to 189 milligrams per deciliter. The numerator is everyone from the 3 risk groups who were prescribed or were already on active prescription statin therapy during the performance period. Again, all of this information will be made available afterwards and can also be found at our website, heart.org/cholesterol.
And so what you see here on this slide is a screenshot of the Check Change Control Cholesterol website. And so I'll go over a few of the links that are available to you here. So you see by the doctor, it has a tab that says Learn How. And that's really taking you to learn more about the actual program, the recognition piece of the program, as well as how to participate in this program. And then you go to About the Initiative Learn More in the bottom left in red. That will take you to cholesterol and how it relates to cardiovascular disease, as well as how check change control cholesterol can really make a difference in your practice. And then if you look in the middle and at the bottom in green where it says Stand and Be Counted, register, that's simply registering for this program. And then where you see Stay and then No, Learn How in blue in the bottom right-hand corner, that's taking you to resources for providers. And so in many of our programs at the AHA, when working with practices, you'll always have toolkits and many resources for providers that you can utilize. And so that would be available to you using that link below. And then so at the bottom of those 3 tabs, you'll see ASCVD Risk Calculator, and that button, that will take you to the actual calculator that is available to you for use. And then lastly, I would encourage you to visit this website. There's a lot of really useful information that you can take a look at and see what might be beneficial for your specific practice. All right, and so this next slide here, this is the welcome page of the Qualitrix survey and what it looks like. And so it's very similar to SurveyMonkey. It's a survey that when you're going to submit the data portions for this program, you would go and you would see this welcome page, and that would let you know that you're in the right place. And so it provides you the different steps to submit data, as well as just telling you a little bit about the program. I would encourage you to download the full survey beforehand if you're planning on submitting data. And there is a full download of the survey that's available on the Check Change Control website for you to use. But in terms of the submission process, it is meant to be a one-time application for each site. So once you log in to enter in all your information, there's no way for you to save that information if you're to leave that site. And so we would want to make sure that you have all of that information down beforehand, and that way you can just easily put all the information into the survey online and complete that data submission. And so here you have the program benefits. And so there's quite a few benefits that come with participating in the check change control cholesterol program. One of those benefits is receiving national recognition annually. And like Stephanie mentioned, when you're entering information for the previous calendar year, that's what you're receiving the recognition for. So in our current period, you're receiving recognition if participating for the year 2017. Check change control cholesterol does empower clinics with a free evidence-based improvement program that includes patient and provider tools and resources to help them track and benchmark cholesterol diagnosis and management in practice. And so where you see provider toolkit and patient toolkit, that's something that AHA also does a lot in a lot of our programs. You'll always have some type of toolkit for both the provider as well as the patient. With the provider, it's more so helping with the patient-provider relationship. And then with the patient toolkit, it's really educating that patient on the importance of really being on top of their cholesterol and their health in general. And so there are also opportunities for continuing education, as well as the patient and provider ASCVD risk calculators, which we already went over previously. And then FYI, most resources will be available in English and Spanish. And specifically the patient toolkits and resources you'll find in both English and Spanish, so we can cater to patients that speak either English or Spanish. On this slide, you see recognition benefits. And so this really is, in many of our programs, we have a recognition piece that we want to recognize those practices that are really prioritizing controlling certain risk factors amongst their patient population. And so some of that recognition includes Check Change Control Cholesterol, our national website. You would be listed on this website as a participant or as a gold level participant. But either way, participating in this program will get you nationally recognized on our website, as well as at our AHA scientific sessions that will take place in 2018. And that would be through signage and printed collateral. There will be certificates that can be displayed within your practice. And then also icon badges with the AHA proclaimer statement, and you can use that internally and externally. And then there's also opportunities for local press releases. So you will receive a template for your clinic, as well as there might be some opportunities with us, with whoever's in your local market in terms of the AHA, and we would want to recognize those practices that are really prioritizing controlling cholesterol. And so on this slide here, you see the timeline for the program. And so the recognition period will be open. It opened on February 5th, and it will be open till June 1st, 2018. And for some of you that might be familiar with our Target BP program, it falls in line with that program as well. And they have the same exact timeline. We encourage sites to register for participation recognition before June 1st, and the sooner the better, so we can make sure all information and data entered is correct and that you would receive the recognition. And then after the deadline for submission closes, sites can still register past June 1st, but we would want to make sure that sites are recognized. So by participating in the program before that date, you would receive recognition. And so next steps really are to register at www.heart.org/cholesterol, and you see the link right in front of you. And then for further questions on check change control cholesterol, you can reach out to myself or Stephanie. We really cover the greater the Massachusetts region. And then if you're located in another state, we ask that you still reach out to Stephanie or myself so we can put you in contact with the appropriate AHA representative.
Great. Well, that concludes our presentation. I'm going to pass it back over to Alberta to help facilitate questions today.
Thank you, everyone. At this time, we'll take some questions. If you'd like to ask a question over the phone, please press pound 6. And you can also pose a question in the chat box by sending your message to all participants. So, to start, does anyone have a question?
No.
Okay, and I'm going to repeat. If you want to ask your question over the phone, press pound 6. And to pose a question in the chat box in the lower right corner of your screen, you can press it there, but make sure that it says send to all participants.
Al, this is Karen. While we're waiting to see if there are any questions, would you mind advancing to the next slide for the resources and tell people how they can access the slide deck?
Okay. In the chat box, you'll see the link to where you can get today's slides, and the screen that is currently on the up right now will be accessible through that. We do have a question. It says, is there a plan for this to be translated into any languages?
So the materials, some of the patient materials will be available in Spanish, English and Spanish. As of right now, those are the only languages available, but we certainly, take in any feedback that you have, and we can work, nationally to see if we can have that happen.
Okay, does anyone else have any questions? Okay, so as a reminder, we now have social media, so visit us on Facebook, LinkedIn, or YouTube. When we close out of the webinar today, the evaluation will automatically pop up on your computer. If you could please fill that out, we would greatly appreciate it. If you don't have time to fill out the evaluation right now, or you're currently sharing a computer with someone else, you'll receive an email tomorrow with the link to the evaluation as well as a link to the event page on our website. The slides are available on the event web page. Within the next few business days, a recording and a transcript of this webinar will also be added. I've put that link for you in the chat box again. And thank you for attending, and have a great day.
Thanks, everybody. Thanks, Stephanie and Sherelle.
Yes, thank you, everyone.
The user has disconnected. The current